Hi, my name's Brogan. I'll be your nursing student today. I just wanted to take a few minutes to talk about your recent diagnosis of multiple sclerosis or MS. I know that this diagnosis can be scary and confusing, but I'm here to help you manage it and go through a couple things. So first, what is MS? MS is a chronic condition that affects the central nervous system, which includes your brain and spinal cord. Basically, your immune system mistakenly attacks the protective coating around your nerves. That's called myelin. When your myelin's damaged, uh, it affects how messages travel between your brain and the rest of your body. That's why people with MS experience fatigue, numbness, weakness, or even trouble with balance or coordination. Um, Now that there's no cure yet for MS, there are some medications that we can do to help relieve and reduce symptoms and also slow down the disease. We can give you Copaxone, uh, Avonox or Avonex, Betaseron, and then if you are having a flare up, we can give you some corticosteroids, like prednisolone. It helps reduce inflammation and helps you heal faster. We can also give you some baclofen that helps with your muscle spasms if you're experiencing those. Some patients also take medications for fatigue, pain, depression, and bladder symptoms. So we can work to try and figure out what you need. Um, but please remember, if you're having any side effects or concerns, don't stop that medication until you talk to your provider. Some tests that we'll keep up with are MRI scans just to look for new lesions and keep an eye on the progression of your disease. We could do a lumbar puncture. This helps us see what certain proteins are in your spinal fluid. And then we'll keep up on blood tests to help look at overall health and any medication side effects. Um, Therapy is another big thing with MS. We'll have you start physical therapy that helps you stay strong, improves your balance, and then it helps you stay mobile longer. We'll also do occupational therapy. This helps you find ways to do daily tasks easier and the use of assistive tools if you need them. Um, some lifestyle changes that you could do, this will help in the long run, is just try to stay active, whether that's 10 minutes, 30 minutes a day, walking. Um, you could also do a balanced diet. That'll help with your immune support. Um, Avoid going out in the sun on a really hot day. That can make your symptoms worse. Um, Make sure you get plenty of rest. I know fatigue is common with MS, so don't be afraid to take breaks. And don't forget about your mental health. Journaling, counseling, and relaxation techniques are a great way to start with that. Um, and then having a routine and a support system in case you do have any flare ups, that'll help a lot. Um, Lastly, I just want you to know that you're not alone. There are plenty of support groups, counselors, and other resources we can help you with. Um, it's unpredictable. MS is unpredictable, but we can also help you find the right care and support you need. Many people live full, active lives. Um, so if you have any questions, feel free to ask. Um, I'm here. Thanks.